October is Breast Cancer Awareness Month, and we are indeed here to talk about breast cancer. So, what is breast cancer? What are the risk factors for breast cancer? What are the signs and symptoms of breast cancer? How can you diagnose, or how can you have the impression that you may be having a breast cancer? What are the treatment modalities? My name is Dr. Ahmed Abdulrahman, and I'm here to guide you step by step in your way to the prevention and breast cancer awareness. So, without talking much, let's go into details. What is breast cancer? Actually, breast cancer is a disease in which the cells in the breast grow out of control. We all know that on daily basis, cells in our body grow, they increase in number, and some die. So when it gets to a point where the cells grow without control, so that means they keep increasing in number, and this makes them uncontrollable. They lose that control, that balance, and this makes it a cancer. And when that happens in the breast, you see a person has a breast cancer. Breast cancer is actually the most common malignant tumor in women. An early detection of this cancer is possibly through monthly breast examination, as you may be aware already. It is recommended for women of childbearing age to have at least once every month examine your breasts. Okay, and women below the age of 40 are recommended to have periodic screening once every 3 years. That is by doing uh, ultrasound. And women above the age of 40 are to do a screening once every year. Okay, so these are the recommendations in order to prevent or protect yourself from this breast cancer. We need to detect it early, and that's why we are trying to create this awareness. Your life matter, and so you should take this very seriously. So what are the common risk factors for breast cancer? So being a female is one of the risk factors for breast cancer. Of course, breast cancer can occur in males as well. So don't forget, whether you are a male or female, you can still get breast cancer. However, it is low in male as compared to female. In Ghana, it's only about 2% of males who get the breast cancer. In other countries like the US, we have it ranging between 1 and 1.5%, according to literature. Okay. And the other thing is the age. The older you are, the more the likelihood of getting cancer. Not only breast cancer, but other forms of cancers. You need to be aware. Okay? So, if you are a female, age more than 65 years, you are at least 50% chance of getting cancer, breast cancer. Another thing is genetic predisposition. If you have a family history of cancer, then you are at higher risk of getting cancer. In advanced countries, people actually have mastectomies because their family members had cancer, just to prevent them from getting the cancer. Okay. So having a genetic predisposition increase the likelihood of you getting cancer. Another risk factor is previous history. If you are somebody who has had cancer in the past, not only breast cancer, if you have had any form of cancer in the past, you have higher chances of getting a breast cancer. And another one is early menarche. And menarche is your first menstruation, you ever had. That's menarche. If you have it too early, you are at risk of getting cancer. And late menopause. If you have late menopause, that's your menstruation takes a number of years than the normal age range for menopause, then you are also at risk of getting breast cancer. Another thing is somebody who has never given birth before. That means the person has not even breastfed any child. Let's assume that. So if you have never breastfed any child, you are at high risk of getting cancer. Okay. Another thing is smoking and alcohol. It is a risk factor for almost every form of cancer and other chronic diseases. So if you are a female and you smoke or take alcohol, you are at high risk of getting breast cancer. And obesity. Obesity can also expose you to getting breast cancer. And how it does that, it converts the excess fat, the adipocytes, converts a certain hormone into another. Okay, so it converts a certain hormone into estrogen. And this estrogen, high levels of estrogen in the body, increases your chances of getting breast cancer. That's how obesity exposes you to breast cancer. So let's come to the symptoms of breast cancer. Usually, a female will present to the hospital with complaint of mass in the breast. So the mass may be tender or not tender. That is, it may be painful or not painful. She may also complain of changes in the size or shape of her breast, or even change in the shape of her nipple. She may also present with swelling in the armpits. Medically, we say axilla. She may present with a swelling in the axilla. Okay. And another thing is, she may present with a swelling of the upper arm. These are common presentations of breast cancer. You may have a swelling in the upper arm. Okay. Another thing is change in the skin color of the breast. So you know the normal color of your breast. When there is a change in the color, always compare the two breasts. So when you notice a change in the color of one breast, the skin, you have to present to the facility for further assessment. Another is ulceration of the breast. And the last one we are going to talk about is discharge from the breast. Some people have some discharge from the breast. It could be milky in nature. It could be bloody discharge. It could be a clear fluid discharging from the breast. These are all common presentations of breast cancer. Now, when you have breast cancer and you present to the facility, we have certain investigations that we will do. After taking the history and examining you, we are likely to recommend for a mammogram or an ultrasound depending on your age. And then possibly afterwards, we will do a biopsy of the mass as we identify. And the treatment modalities, we have about 4 of them. We may rely on 1 or 2 or combination of any form. So we have surgery. We may do surgery to remove the mass or the entire breast. We may also explore radiation therapy. We may do a chemotherapy. That means we are using only medications. And we may also explore hormonal therapy as it has been done. Some of the cancers usually they respond to some hormonal therapies, especially some of the cancers that have estrogen receptors. They usually respond to hormonal therapy. And we may combine any of these 4 in any form. We may combine surgery and radiotherapy, we may combine surgery and chemotherapy, or we may combine surgery and hormonal therapy in any order. Okay, so this brings us to the end of our discussion on breast cancer. Feel free to leave a comment. Please do like and share the video, and don't forget to subscribe. This is Breast Cancer Awareness Month. Don't forget, your loved ones and your health are the key players to your happiness. Please share. Thank you.